it's Luisa Lyons here, just here to talk to you about weight gain in babies. So we're going to talk about normal weight gain for young babies. First of all, it's important to note that most babies lose weight in the first few days after birth, and generally the lowest point at which the baby should lose the most amount of weight would be around 72 hours after birth, so around day 3. And at that point, the physiologically normal amount of weight that babies can lose is up to 5 to 7%, according to the best available research. So anything more than 7% around day 3 is an excessive amount of weight for babies to lose, and that is when we would trigger some management plans, which I'll come on to. So first of all, it's important to say that babies can sometimes be born with an overinflated birth weight, it's thought, particularly if the mother has received IV fluids. So perhaps if you've had an epidural or a caesarean section, if you were dehydrated when you went to labour and needed IV fluids, then babies can be born overloaded with extracellular fluid. So they excrete this out in the form of weeing out the extra fluid, and this can mean that sometimes there is an excessive weight loss of maybe 8, 9, 10% when actually feeding's going really well. So it's not a fat loss as such, it's a loss of water. However, sometimes the baby loses too much weight because there is a feeding problem. So some of the causes of excessive weight loss is either not long enough feeds or not frequent enough feeds, at least 8 to 12 in 24 hours, or rarely a medical reason why the baby's not gaining weight that is as yet undiagnosed. And that's why we take it really seriously. And if we uncover that your baby has excessive weight loss, we will usually perform a set of observations to check their heart rate, their temperature, their breathing rate, their colour, their capillary refill, and their tone. And we'll also check for jaundice as well, and often this is done with what's called a transcutaneous bilirubinometer, which is a non-invasive way of testing the baby's levels of bilirubin by pressing a little light sensor onto the sternum. So what to do if your baby has not gained weight effectively? And what we're looking for as normal is that after day 3, after that point at which their weight loss is at the maximum it should be, that they gain at least 25 to 30 grams a day as a normal. And that will carry on till around 6 months at least. The lower level of normal weight gain is around 25 grams, unless your baby was significantly more premature. Even up to about 36 weeks gestation at birth can sometimes only gain 20, 22, 24 grams a day. But in general, for a healthy term baby, we're looking at least 25 and more towards 30 grams of weight gain per day on average. So if your baby's not been weighed for, say, 5 days, after day 3, we would expect a weight gain of around 125 grams over 5 days as a minimum, just to give you an idea. So what to do if your baby hasn't gained enough weight? It can be really worrying, and seeing weight gain concerns are some of the most stressful things that I see parents dealing with. It can lead to parents feeling overwhelmed, really worried about their babies and frightened, and also really doubting themselves and questioning themselves about feeding. So the first thing to say is to be really kind to yourself and reach out for highly skilled support from an IBCLC or an experienced midwife who is used to dealing with weight gain issues. The management plans that I've implemented when I was the infant feeding lead at the local hospital include screening out illness, as I mentioned, by doing a set of observations on the baby, making sure that we're monitoring the urine and stool output. So babies should have at least the number of wet nappies as days old they are. So at least 1 nappy on day 1, 1 wet nappy on day 2, 3 on day 3, 4 on day 4, 5 on day 5, and at least 6 wet nappies that are getting heavier and heavier from day 6. And from day 6 postnatal onwards, babies should have at least 6 wet nappies in 24 hours. So every 4 hours it should be wet, and it should be increasingly heavy. Also really, really important is stool output. So please don't believe any of the myths that babies don't poo very much when they're breastfed. This is not true before 6 weeks old for the huge majority of babies. It's always a red flag when babies aren't pooing enough. So the thing to be aware of is that babies after the first day or two of life should poo at least 2 to 3 times in 24 hours. The more poo, generally, the better. And babies should pass at least 2 stools, preferably more 3 and upwards. And the stool should change colour. So on day 3 and around that time, they should change from a meconium stool to what we call a changing stool, which is a brown or yellow stool, a brown or green stool. And then by day 5 after birth, the baby should be passing a yellow stool, a bit like the colour of the lampshade behind me, sometimes called Coleman's mustard yellow, or Norwich City if you're a Norfolk person. Sometimes also called korma colour, and the amount of poo should be at least 2 £2 coin sizes worth, and again, the more the better. So that's how to know that your baby's getting enough milk. They should be pooing plenty, they should be weeing plenty, and they should be gaining enough weight after day 3, at least 25 to 30 grams a day. So the other thing that you can do with your midwife or your health visiting team is to ensure that babies are getting good, effective positioning and attachment. So one of the main causes of ineffective weight gain is that the milk transfer is not effective. So ruling out positioning and attachment by having somebody skilled to check your positioning attachment, ruling out other oral anatomy causes such as tongue tie, cleft lip and palate, babies with a low tone, with neurological conditions or chromosome conditions, making sure that there's nothing affecting the baby's physical ability to latch effectively to the breast and to draw milk from the breast. Ruling out causes of low milk supply that I talked about in other videos, so looking at the placenta and membranes and making sure they were complete and there's none left in the womb at all. Looking at hormonal issues such as thyroid problems, polycystic ovaries, diabetes, insufficient glandular tissue, and other conditions that may increase the risk of a low milk supply. Also looking at breast compressions, as I've mentioned in a previous video about increasing milk supply. So effective breast compressions and switch nursing can be really effective for weight gain. So effective breast compressions, for a really good video, if you type into search engine Jack Newman breast compressions, that's really effective to watch the video there. But doing really good deep breast compression, so your hand really far back in the breast, not just close to the nipple. It needs to be far back in the breast with as much breast tissue in front of your hand as possible, and compressing for a good 5, 7, 10 seconds, not compress and release quickly like you do for hand expression. It's a really different technique, so please reach out for support and get somebody to check the technique is correct, because it's easy to get it a bit wrong. Breast compressions can really help, as can switch nursing for sleepy babies, jaundiced babies or weaker babies. So again, switching from one breast to the other to wake the baby up essentially if breast compressions have not worked. The midwife or maternity care assistant or your IBCLC, if you're able to see one, will be assessing the rate of milk transfer. So they'll be assessing the suck and swallow ratio. And in active feeding in babies over about 3 days old, this should be a suck-swallow ratio of 1 suck to 1 swallow, or 2 sucks to 1 swallow during active feeding. Obviously, towards the end of the feed, when it's the higher fat milk transfer and the lower volume, the suck-swallow ratio will increase to about 5, 6, 7 sucks per swallow, and that's fine as long as the baby has done that 1-to-1 or 2-to-1 suck-swallow ratio in active feeding, and all is well with their weight gain, urine output and stool output. So that's a little bit around weight gain in babies and what to expect. There's so much more I could say. So all I would say is if you've got any weight gain concerns at all or issues, please get in touch for some skilled support.